Good morning, everyone. Thank you for joining us. We will be getting started in just a minute. Just want to check your audio, make sure you can hear us, and we will get started with our LionSide Chat in just another minute. All right, we're going to get started. Welcome to Penn State Berks LionSide Chats. My name is Ryan Hassler, and I'm one of the three LionSide Chat moderators working alongside Don Pfeiffer-Wrights and Sonia De La Cueto. Come on in and welcome to our campus. We are so glad that you could join us today. Before we get started, we wanted to share that you should please feel free to submit questions via the question and answer feature in the webinar. We will not be utilizing the raise the hand feature, but we will be interacting with the Q&A at the end of our conclusion of the presentation. We will facilitate that discussion with our presenter. So we will also be recording today's session, so you can revisit the topic or even share the experience with friends and family. Now we are excited to introduce Sharon Pitterson-Ogaldez, who will be speaking about how culture affected or affects the responses to COVID-19. Just as a quick introduction, Sharon is the coordinator of diversity and international programs and is the chair of the Penn State Berks Diversity Committee, among many other things that you can see there on the slide. So with that, I will turn it over to Sharon. I'll invite you to share your screen, and we look forward to learning and hearing a little bit about various cultures and their responses to the pandemic.
Thank you, Ryan, for that introduction, and thanks to everyone who has joined us today to hear about culture and how individuals responded to the COVID-19 pandemic. As Ryan said, I'm from Penn State Berks, and before it became a pandemic, I had been interacting with my international students who were from China, who were telling me about what was going on in China, how it was affecting their economy, the ability for them to move around and not move around, and what that was doing, and the fears that they had and their parents had. And as it moved into a pandemic and we got sent home to work from home in our state, I started to reflect in my field of diversity and culture. What does this mean? What is going on? How are different countries reacting to the pandemic? And it dawned on me that there was something that looked different based on the cultures that were there. And so I decided to write this article, and from the article, I'll be doing this presentation this morning on how culture affects. So here's what we're gonna do. We're talk about, I just did the background of how I came to focus on the COVID-19 pandemic. The countries that I'm choosing to highlight today are China, Italy, Korea, Spain, and the USA. I'm gonna start off around describing what culture is, how we organize and understand culture, look at change in times of crisis, government strategies that were implemented by the different countries here, look at the change in the infection and death per country, and then the citizens' response to their government directives and some conclusions. So culture can be looked at in terms of an iceberg. As you see in this picture, we have the iceberg. Although it looks massive above the water, in terms of culture, that is only 10% of a culture. That's the visible parts of the culture. That when you think about culture, you think about food, clothing, music, dance, language, architecture, types of policies and laws that are in a particular country or group. But in fact, the greater part of culture is invisible to us, and it is the 90% of that iceberg that sits below this deep water here. That includes components such as our values, spirituality, ethics, communication style, conflict style, our attitudes, use of time, and use of space. Hofstede has developed some cultural dimensions, 5 of them, and one of the dimensions that I picked out to look at today is the dimension around being a collectivist versus an individualistic culture. So for a collectivist culture, usually the people are more focused on their family or their community. They look at group goals and try to achieve group goals more so than their own personal goals. There's a lot of interdependence where they rely on each other to get the work done or to achieve success. And they look at what is best for the society. And a big feature is harmony, maintaining harmony. So they try not to do anything that will cause losing of face to others. Some of the countries that are collectivists: Japan, South Korea, India, and China. And as you see, 2 of them that we're looking at today, Korea and China, are collectivist cultures. On the other hand, individualistic cultures tend to focus more on the individual and seek autonomy rather than looking at the community. They're more focused on their own personal goals and what they need to achieve for themselves. They're more independent, and focus is more on individual rights. What is my right versus the community? And people tend to defend their rights and not yield that right to anyone or even to the government. One of the features is that people tend to seek to stand out or to be unique. And this is a part, if you think of our own culture, it's our uniqueness and autonomy that helps to drive the economy in people having small businesses and inventions and so on. Countries that are individualistic are the US, Germany, South Africa, Italy, Australia, and Spain. I have an asterisk beside Spain because Spain is an individualistic country. However, amongst the Western European country, Spain would more seem to them as a collectivist culture. So what is culture? Culture can be defined as the system of knowledge that is shared by a group of people for communication and survival as a distinct group. So the group has to interact together over time, and they decide what their group will be, how they will operate, what are the systems, the policies, the rules, and regulations, and so on. Culture is passed down from generation to generation, and that is what keeps culture in place and maintains it so that it does not change much. It guides our behaviors and also our perception of the world. Our culture is like blinders that I like racehorses, so if you ever see horses racing, they'll have a shield over their face, which prevents them from seeing anything except what is in front of them. And our culture is like that. It put blinders on us and it limits us from seeing all the stimuli that is in the world around us, and we only will process them according to how our culture has programmed us. So our culture, in other sense, is like a computer program that programs the equipment on how to process information. Some of the ways in which culture has programmed us is in the types of government that will be formed for the groups, the attitudes that the people have towards their government, concerns of the concepts of what is a group versus what is an individual or yourself. And our culture is used to help develop what our identities are. So I mentioned values as one of the characteristics of culture that is in that 90% that is below the water level. So we're going to look a little bit more at values and how they affect our behavior. The real foundation of cultures is wrapped up in the values that the culture has decided to adopt for themselves. The values are learned in your cultural group. Many of our values are learned subconsciously, and so we're not even aware that they are cultural values that we have. They direct our behaviors so that what we do is based on the values that we have. Values can be personal, they can be cultural, or they can be global. In terms of personal value, the way that you wear your hair can be seen as a personal value because you're choosing to wear your hair in that particular style. A cultural value could be greeting, the style of greeting that is used. In some cultures, people will shake hands, some people will hug, some will kiss each other on the cheek, the left cheek first, then the right cheek, or they may kiss on the forehead, and so on and so forth. And then a global value would be avoidance of danger, which means you'll find that in every culture. The way in which it's done may be different, but everyone across the world will want to avoid danger. Societal rules are based upon our values, and some of these rules, as we spoke about before, individualism versus collectivism. What do we value? Do we value the individual versus the group more? And we have like economic systems, capitalism, communism, religion, other belief systems, whether something is good or whether something is bad, it's all based on our values. And the systems of government, as I said before, is all based on our values. So we set up this type of government, for example, that we will fit the values that we have as a society. And that's why we have different types of government systems and ways in which we replace government leaders over time. An important thing to consider in terms of a pandemic or any type of crisis is that there needs to be a behavior change when there is a crisis. Just imagine that if you're a parent and you see your child heading towards an electrical outlet to stick a scissor in that outlet, that's a crisis about to happen, and you're going to respond very rapidly. And most times you're not even thinking or processing, or you can't determine that you're thinking or processing. It's like a reflex action. And this is what is needed to respond in times of crisis. Psychologists have done research that is called the psychology of conformity research. And this was gained from an article by Kendra Cherry, where she mentioned 3 different crucial experiments. One in 1932, the Jeunesse experiment, where beans were put in a jar. Individuals were asked to count the beans, estimate the beans, how many beans are in the jar, give their number. Then they had to do it again within a group setting where the group gave their number, and found that individuals would change their original estimation to match that of the group. Similar experiments were done by Sharif with autokinetic effects, using light, distance of light travel in a dark room. The light was stable, but people were estimating, and they did the same thing. They changed their original estimation to match the group. And also, 3 lines in the Ashes conformity experiment, 3 lines were given, and each individual had to match 1 line that they had to which of the lines, and the same response happened. So what psychologists came up with were 2 types of conformity. One is informational conformity, where people will change their behavior based on information that they receive from people that they believe are more knowledgeable than themselves, as well as normative conformity, where they will change their behavior in order to fit in with the group, or they'll avoid punishment or to gain some reward. In terms of what happened during the pandemic, we're now going to look at the 5 countries that I have chosen to highlight. The government strategies that were used to reduce the spread of the coronavirus in China, where the outbreak of the virus started, the government, after some time, decided to do a national lockdown of the country. Mask wearing was required. They did testing, they did contact tracing for the people who were in contact with those who were positive. They asked people to go into quarantine, but they also disseminated regular information and updates about the status of the um, infections, the deaths, the locations where they were occurring. They deployed people into the rural communities who would inform the people and help them to conform to the government directives, and also to assist their citizens in acquiring the food and other necessary supplies that they needed for daily living. In South Korea, they did not lock the country down, and to date has not locked their country down. What they did, at first, they weren't taking it as seriously that it was going to be a big problem for them. And then quickly after, they decided that they were going to proactively get in front of the disease spreading. So they did early testing. They required their citizens to self-report when they're infected and to participate in contact tracing and put themselves into personal quarantine. In Italy, when this is where it started spreading to many parts of the world from Italy, because Italy had just opened up a new tourism initiative that they had with China, and hundreds of tourists came in from China around January, February into the country, and they also brought back citizens, Italian citizens from China during that time. Most of the outbreaks occurred in the northern region of the country. And so they started locking down the northern region of the country, but not other places. And they increased their restrictions on movement of the people in a gradual manner. And different parts of the country had different approaches to how they were doing the testing, what they were using as their tests, and the people they were testing, and how many tests they were doing per day. In Spain, they thought initially that since they're not close to Italy, that they would not get infected and they would not have as big as a problem. And so initially, the government, when they saw that it was spiraling, the government then had a state of emergency. They moved later on to a national lockdown. They closed schools, and they eventually they had to use the police and drone patrol to keep people off the streets. Their medical system, although it's a good medical system, but it is not a nationally coordinated system. And so the different medical entities had different approaches to how they would test and treat infected patients. In the US, we had gradual lockdown in some states. There was local, gradual encouragement and requirement for people to wear masks. There was testing only of symptomatic persons who had to go through their doctors to get tested. And we are just now on the phase of doing contact tracing. And one of the things with the US is that there's a lot of mixed messages that is going out from the federal government and from different state governments to the people. So to take a look at the way in which the infection moved from, I took April 1st and then Monday of this week to look at the changes for these countries. If you look at them, in April, Italy had 80,000 infections, and on Monday, they had 244,000 plus infections, and the deaths had moved from 8,000 plus to 35,000. Spain had at that time 56,000, and now they have 260,000 infections, 28,000 plus deaths. In South Korea, they had 9,000 infection, 139 deaths, and on Monday, they had 13,000 infections, 283 deaths. China at the time had 82,000 infection, 3,298 deaths, and this week, 86,000 plus infections, 4,653 deaths. The US, April 1, 68,000 infections, 991 deaths. On Monday, 2.7 million infections, 128,000 plus deaths. If you look at the countries, Italy, Spain, United States, which are individualistic countries, you can see that the infection rate is far higher. The way in which it's spread across the countries is far higher than Korea and China that are more collectivist cultures. And as I said, in these two countries, Korea and China, the government had a national strategy for the people, whereas in Italy, Spain, and the US, the national strategy is either absent or it has come at a much later time. So how did individuals interact to the government directives that were given to them? In China, the people responded wholeheartedly to the directives that the government gave to them. The people believed the information that was shared by the government and responded to it. They utilized self-discipline, family accountability, and the trust in the government to follow those directives that help to reduce the rate of the spread of the disease in their country. In South Korea, they had an individual approach, and this is probably why they did not need to do a countrywide lockdown, because individuals held themselves accountable. They cooperated with the directives that their government gave to them. They did it because they thought it is good for the community, and also that on a whole, they tend to have trust in their government. In Spain, it looked different. Some factors that was beyond the control of the government. Many of the people in Spain are over 60 years old, which was the population initially that took the brunt of the infection. Their cultural practices, also, some of them, when they greet each other, they tend to kiss on both cheeks. And the virus is spread by aerosol from when we're speaking and and breathing out. So they're bringing their faces into close contact with each other. So it's a higher possibility of spreading the virus. They also have a very vibrant nightlife, and people are often seen in the bars until late at night, talking with each other, laughing, hugging each other, and having a great time. Other behaviors that happen is that the government did not stop large events. And so people were attending large events in the early onset of the infection in the country when people were in their incubation state, or people were already carriers who were interacting amongst them and spreading the virus. They traveled to the beach. People were going to the beach, going to soccer match in large stadiums, And people, they also had a large protest around that time. And so many people were exposed to the virus. And so you see these individual responses cause the high numbers that we saw in Spain. In Italy, at first, they did not take it seriously. Some people joked about the COVID-19. They were having jokes about it. Some politicians modeled social mingling instead of social distancing. They did not think that this would be a crisis for them. And also, the people move, as I had said before, people move from the north where the infection started down to the south and to some of the islands. And so they spread the disease amongst themselves in that way. And they also have similar greeting practices to Spain, where they hug and they kiss each other on the cheeks as well. And so these were, methods for spreading the disease. In terms of the United States, I'm trying to get to what was happening here. Anyway, in terms of the United States, there still has not been a federal countrywide directive to shut down the country. Individual state governments have decided to shut their states down, to have stay at home or work from home mandates for people, and parts of the states gradually, and to wear masks. And now you see some business organizations are taking over, mandating that patrons to their business must wear masks to them. There have been protests that coincided or on top of what has been happening, the racial protests around racism in the country over George Floyd's death and other Black African-American deaths at the hands of police has happened at the same time, which exposed people. And you see a lot of people at these protests who are not social distancing, not wearing masks. You've had other gatherings like political gatherings that people were not wearing masks or not social distancing for them. We also had protests from states that did not initially have a problem with the infection, protesting opening of businesses, that all the businesses in the country should be open because they're not seeing the effects of the coronavirus and the deaths that it's causing. Some people thought it's a hoax. And even some politicians and religious leaders who thought that this is a hoax went out and they modeled social mingling rather than social distancing in the initial stages. Now, some of those states are having their spike in coronavirus infection and deaths across their states. So what does this mean? In conclusion, I would like to say that based on what I have observed, what I know of culture, that during the times of crisis, rapid behavioral change or conformity is needed by citizens. During crises, people respond based on their primary culture. It was easy for the people of China and Korea to respond to the directives that their government gave because they were already used to a collectivist culture where they would respond for the good of the group. And so it was not difficult for them to respond quickly because that's their primary way of orienting how they behave. Culture influences decision making, and also individual citizens' response to the decisions that are made by their leaders. It is easier for people who are from a collectivist society to whole scale follow the direction of their leaders when there is trust in those leaders. It is harder for people who are from individualistic cultures to follow a national plan for all of the citizens to at the same time change their behavior in the same direction. As we see, the individuals from the collectivist culture, I said that already, responded quickly. In the individualistic countries, it was much harder because another feature of how individualistic countries are set up is that the government tends to have a certain amount of decentralization to it. In the United States, for example, we have the federal government that is responsible for some aspect of governance of the country, but then you have the state governments who are responsible for their local areas, and the federal government has to balance their power and leadership with the state government power and leadership. And this was similar in Italy as well, that they had very powerful equivalency of state governments there. And so it was harder for there to be a national strategy put in place. When people have lack of trust in politicians or the police, they do not quickly adopt their behaviors to control the spread of the virus. And this is what I believe from a cultural standpoint resulted in the higher infection in the more individualistic countries that we look at. So in the end, what I can say is that we are programmed to behave according to our cultural values, and that limits us in times of crises when we need to change quickly and we need to rapidly move to save ourselves, even from extinction. These are the sources that I use, and I will send them to the organizers so that when you get the link for the presentation today, you can go back and read and see some more details about the countries that I looked at today. I want to say thank you to the organizers. Thank you to those who listened to what I had to share about culture and its effect on how individuals respond to the COVID-19 pandemic.
Thank you, Sharon. Really appreciate it. Lots of fascinating things there, looking at it, from a different perspective than what I think a lot of people, think of the virus as, in terms of the biology and whatnot. But let's invite Sonia now. So Sonia will be here. I invite our audience as well to go ahead and populate questions in our Q&A. And we'll get started with that. So Sonia, I think I see a couple questions there.
Yes, we have our first question. Is individualism mostly to blame for America's failure to stop our massive death count?
I believe that in a big part of it is the individualism, because in an individualistic society, you have been trained to look out for yourself and for your small group that is related to you. And so if it's not directly affecting you, then you don't feel the urgency to do anything or to change. And so, yes, I believe that that has a big part of what happened with us or is happening.
We have a comment that also has been shared. Yesterday, the New York Times cited a study that suggests that almost 50% of the population may choose to not get the vaccine when it's available. It's thought that low participation rates ties to the fact that we, the United States, have an individualistic culture. I won't put that in my body rather than the collective culture where we would get the vaccine to protect our community.
That's another example of how the individualistic culture can go against what is good for the society. And I know people here who, I have friends who they have not had their children take any vaccines at all. And I even remember one of them, her daughter was getting married to someone from a different country. And she was really nervous because she's like, what if they believe in taking vaccines and I don't? What will happen to my grandchildren? And so that is a really good indication of or example of individualism and how it plays out.
And conversations to have before you're at the altar, right?
Yes, definitely, definitely, definitely.
Right. Thank you, Sharon. Another question to follow up. Where do you think this dangerous, deadly individualism comes from?
It comes from the founders of the United States. That's where it comes from. The people who came over from Europe and decided that this would be their homeland, when they decided to come together, those 13 states, original 13 states that came together to set up the Constitution, which governs how we will do life in the United States. That's where it came from. They were coming from monarchies where the people were serving the monarchs and working to give to the monarchs. And that's why they set up the system that they set up here that is based on individualism. That is why this country also, they came for religious freedom, it was one of it. And so they separated church from state so that the state, there would not be a state directive in terms of what religion would be practiced and how it would be practiced. They had their individual freedom to choose their religious practice. So it's from the founders who set up the country.
Right, and one of our comments was saying it's even in the phrase "we the people" from the United States, "we the people of the United States." Great, thank you. Next question, Sharon. A pandemic has been expected for many years. The previous administration left a manual of how to respond. Would the outcome have been different if the instructions had been enacted?
I believe the outcome would have been different. I came from a country that I participated, I was in the health field, and I used to participate every 2 or 3 years in a national disaster preparedness plan. And the main thing that we prepared for were biological, because we were on an island. It is difficult for us to manage when it comes. So we had a national disaster preparedness plan from the health field and from the veterinary field. And all the people in charge were involved in that. And so China and Korea also had their own plans from when they went through SARS and MARS and the swine flu. They had all of that framework in place. So if we had a framework in place, then it would have helped us to respond from the federal level, which would be able to mobilize more of the resources and coordinate the response, which would have reduced the rate of infection and the number of deaths. In the same way that we have plans to address hurricanes, to address tornadoes, to after 9/11 happened, we need to have plans in place for at the federal and at the state level to address issues like this.
So
Thank you, Sharon. Go ahead.
Can I interject there? Just so as a follow-up to that, Sharon, I'm just curious, would you then tend to, believe that differences in response might be a function of leadership as opposed to culture that we were talking about here? Or what's your take on that, the difference between leadership and culture?
I would say that leadership falls within culture. And so the culture also will limit the way that the leader believes they can act and how much latitude and leverage they have. So in yes and no, it has to do with culture first. It has to do with leadership within that cultural framework to be able to rise to the occasion and to be able to step out of that cultural mindset, as we would say, to step out of the box and to look for innovative solutions in that time. One of the trainings that I do is called culturally competent leadership. and is to develop cultural competence as leaders to understand your own culture, how it programs you to behave, and look at other cultures and how it programs them to behave, and to be able to be flexible. One of the components is being flexible to move and shift, and to know how you can, within your cultural framework, you can influence people to conform to the change that you need. So, for example, having consistent national information that people would trust, knowing how to build trust amongst the people and to be able to disseminate that information would be a part of the leadership within the culture.
Thank you, Sharon. We have got questions are just pouring in, so I'm going to keep going with that. Is it possible for collectivism to exist within an individualistic culture?
Yes, it is possible for it to happen. So those were really big, broad generalizations that I gave of collectivist and individualistic culture. The way that human nature works is that you will find people who can operate in a collectivist way within an overall individualistic society, and vice versa. There's always this bell-shaped curve where majority of the people within the culture will behave in this way, but you will always have outliers who behave to some degree all the way to the opposite.
Thank you very much. I know Dr. Hassler appreciated that shout out to the bell-shaped curve.
Shameless plug, we'll be doing some statistics in a couple weeks in one of my
yes, definitely. I love statistics, was one of my favorite subjects too.
All right,
Not many people say that.
Yeah, so you can talk about that later. Did your research show any commonalities between the 1918, 1919 flu to today regarding culture?
I did not do any research on the 1918 flu at all. I just limited it to what was happening today.
Okay.
But I will go back and look at that.
Right, that was literally a whole nother time with a whole nother set of parameters, but that would be another interesting chat too.
Yes.
What are the repercussions if in an emergency the government must develop a collective effort such as during World War II when everyone had to pitch in? So what are the repercussions if in an emergency the government must develop a collective effort?
Some of the repercussions is that people would have to give up their individual rights, which when you're used to having a right, it's not so easy to give it up. And you feel that the government is intruding and they're taking away from you. And so citizens could rebel and decide that they're not going to do what the government is saying, or they could try to sabotage what the plan is and cause problems in other ways to happen within the country. So those are some of the ones that I think about, which would be detrimental to the cause of moving forward, which then puts everybody at risk.
Okay. This question was one that I was thinking throughout your presentation today. What would it take to move America toward a more collectivist, less individualistic approach? Clearly, it's more than a pandemic, Sharon.
It will be more than a pandemic. It will have to be probably another civil war that would have to come where we're fighting against each other. And as a result of that, then we have to regroup, reorganize, and rethink who are we and how do we want to be who we are.
Wow. Thank you very much for that.
That's a lot to think about.
Yeah.
I have another question over here, Sonia.
Yeah.
The countries that you mentioned, Sharon, other than the United States, many of them have more homogeneous populations, but the United States is very diverse. How do you think, how can it be looked at as one culture since we are so diverse here in the United States?
That's a very good question. although we are diverse in terms of our population within the US compared to the other countries, what happens is that despite the diversity that exists, we have a national culture. And the national culture is based upon the culture of the people who originally set the country up, and they determine that culture. And so that will be the prevailing culture of the United States, even though you have pockets of people with different subcultures, like African American, Asian Americans, and so on and so forth. But the overall country culture would be the Caucasian American culture that you would respond to, use to respond in this case.
Okay, Sharon, we had another question just pop up. What role does education have in moving societies towards more successful models?
I don't think that it is just education that is needed. What is needed is cultural education to understand culture, and then the people who are in leadership need to demonstrate trustworthiness, that the people will trust them, those who are educated and those who are not educated. So it's education to a certain extent, but it's more trust, because all of your citizens will not have PhD in any country. All of them will not have a bachelor's degree or an associate degree. So it is having that trust that what the elected officials or those who have been put in leadership or place themselves in leadership even are doing is in the best interest of the citizens. And that's what is needed.
Sharon, could you please share one of your favorite books or articles that can help us explore these ideas even further? That was from one of our audience members.
Yes. Let's see. I have so many books that I've read about this, but one thing that I'll say about it is one is Basic Concepts, that is written by Milton Bennett and some other authors. At the moment, I don't remember all of them, but the name of the book is Basic Concepts, and it's basic concepts around culture. And it goes through all of this, how we learn culture, not so much, but yeah, in terms of how do we become more cultural aware and competent is covered in that. The developmental model of intercultural sensitivity, that when we are not exposed to cultures that are different from our cultures, then we deny that what is going on in life has anything to do with culture. And as we become more exposed and learn more about different cultures and see them as equivalent to our cultures, not better than, not less than, but equivalent, different ways of organizing our societies, then we develop that cultural competence that leads us to the orientation that he terms as adaptation, where we can understand and we can move in and out of, we can understand the ethics that is within our country, culture and within others. So for example, when you're doing business across nations, for us, if they give a gift before doing business, we'll see that as bribery and trying to put the decision in their favor. But in some cultures, if you don't accept the gift, they will continue talking with you, but the deal is over already. So being able to understand that and understand how the culture programs us, and if we need to change, for example, if we need to change here to stop what is happening with the virus, understanding our culture and then being able to come up with directions for the people that will help to change our mindsets and our behaviors.
Great, thank you. And Sharon, I wanted to offer, once we post the recording of the webinar on the LionSide Chat site, if you want to send us a list of those books, we can also post it along with your webinar link. Okay?
Great, I'll do that.
We're happy to do that. So,
yes.
One other question that just came in, what is one thing that you want incoming and returning students to know or take away from these individualistic and collectivist models from your talk today?
To realize that even though the collectivist culture worked really well in Korea and China for this particular instance, there are also shortcomings and situations in which it would not work as well. And although individualism is failing us in an instance like this, there are other areas in which individualism works really well. So it is not necessarily saying that the entire world should be collectivist or the entire world should be individualistic. It's that we need to understand what they are and how they program us so that we can become better citizens and better able to act within those frameworks to get the outcome that is needed for our good and for the good of society. That we need to think not only of ourselves, but society. We also need not to sacrifice ourselves for society, but also think about our benefit within the society.
Absolutely. Thank you so much, Sharon. You had mentioned earlier on in your chat about values, ethics, time, and space. And I always remember from a lecture in college about how our values are pretty set, right? But it could be something like a life-altering or changing event that could help us kind of reestablish or re-identify with some new values. So when we're faced with a situation like we're in right now, like what are your recommendations for a person like myself who would always see news clips of China and the individuals of their society wearing masks and thinking, oh my gosh, that could never happen here, right? It's still like a surreal experience when I go out because that'll never happen here. We're invincible here in the United States, but clearly like my world has been turned upside down, as have the lives, and so many people have been impacted by this. So what are our best resources as individuals within this society to educate ourselves on what we can be doing?
I think that that's a great question, and it is going to cause a shift in our day-to-day behavior. And we each need to examine, what do we need to protect ourselves? What do we need to protect those we love? And what are we willing to give up in order to have that? I think those are the things that we need to think about to figure out, how are we going to change? What will we? And like you, when I used to see Asian people in the airport and, you know, in cities and so on with the mask on, I would always think that, oh, that person is sick and so they don't want to infect anybody else. It never occurred to me to think that that person is trying to protect themselves from getting sickness from those around them. And so we have to have those shifts in our thinking, paradigm shifts in our thinking on how we perceive certain behaviors that we have. And yes, values tend to be very stable because they're programmed into you by the time you're 5 years old. And you just automatically behave according to those values without thinking.
And thank you, Sharon. No, thank you so much. And just one other point. I keep thinking about how social media, right? So even with the Spanish flu and everything we went with, like that wasn't a piece. So in some ways, social media really connects us and gets some good things going and also gets some bad things going as well as a society. So what are your thoughts on that?
I think that social media is a double-edged sword. It is wonderful because it can connect us. It can help us to learn about information. So I have one brain and two eyes, okay, and two ears. So I only see this much of the world and hear and listen, can hear and process it. So social media allows me to capitalize on other people's brains and what they're interested in to bring information to me that I probably would not see or have access to that I can use. On the other hand, it can be weaponized and used to destroy, and has been used to destroy people's lives, even prompting individuals to commit suicide. And so, in the hands of those who intend to do bad, it is a dangerous weapon. But in the hands of those who would like to connect and to do good and share information that is useful, it is a wonderful tool. And
Great,
unfortunately, we can't get rid of it, It's how we choose to use it.
All right. Well, thank you so much, Sharon. I really appreciate your talk today, educating us on culture. And although this is a talk about the pandemic and the culture surrounding, the pandemic, I've taken a lot of things away. I often hear the Penn State is a we are culture type of thing. So next time I hear that, it will definitely make me step back and reconsider, what that means from the community that we live in here at Penn State. I also want to thank our tech tutor, Trevor, for standing by just in case we had any technical difficulties. And a special thank you to everyone who joined us today for our LionSide Chat. As you click out of the webinar, you will receive access to a survey. Please do take a few minutes to complete that survey. It will let us know what you thought about today's chat and perhaps even offer us some ideas for future chats. You are encouraged to reach out to us via email, and we remind you to keep checking our website as we are always adding new chats, and we just added a bunch for the month of August. So our next chat is actually tomorrow. It is at 12 noon. It actually will be on the importance of professional networking, and it will be given by a Penn State alumni, Tyler Wackley, who just graduated and really wants to share with individuals, how his time at Penn State Berks allowed him to get to the places where he's at, and how that professional network was created. So be sure to come back soon, meet with another faculty, staff, student, alumni even at Penn State Berks to share their experiences. So stay safe, Berks and beyond. We are signing off now until next time. This has been the Penn State Berks LionSide Chats.